So I'm taking some of the common questions which actually came from my doctor colleagues and patients. So the first question is, how does the coronavirus disease 19, that is COVID-19, affects the baby if the mother is infected? So there is no evidence to suggest an increase of the miscarriage, number one. Number two, the vertical transmission, that is infection through the placenta before the delivery from the mother to the baby, is probable but largely unlikely according to the data that we have so far. In all reported cases of newborn babies developing COVID-19, very soon after birth, the baby was well. That's the good news. It is considered unlikely that if the mother has the virus, it would cause problems with the baby's development, and none have been observed currently, hence no teratogenicity reported so far. Premature deliveries have been reported. It is unclear whether COVID-19 causes early labor. I want to highlight one fact here, that this is based on the evidence that we have so far. I'm making this video on in the first week of April now, and till this time of this pandemic, based on whatever information we have, I'm making this video and incorporating the same guidelines which is at present to today's date applicable, and the information is bound to evolve as we have more data pooling in. Okay, so the second question is, why are pregnant women mentioned in the vulnerable group? Especially if you see the Royal College of Obstetrics and Gynecology, the UK government, they were the first who, one of the firsts who actually said that pregnant women should be put in the list of the vulnerable group of people. So why was this done? Pregnant women, first of all, are still no more likely to contract, or they are not more susceptible to the COVID-19 than the general population, number one. But some viral infections are known to be worse in pregnant women because the immunity is low when a woman is pregnant, and hence this has been done as a measure of caution. Okay. Question 3. What do you need to do if you're pregnant? Follow social distancing. Importantly, if you're in your third trimester, there's a chance that you might still be in the acute phase of infection when you enter your delivery. With not enough IgG antibodies for yourself and your baby, hence, after 24 weeks of being pregnant, please follow strict social distancing, and additional shielding measures must be followed by the pregnant woman with significant heart diseases, congenital or acquired. Question 4 is, should you attend the antenatal and the postnatal appointments? Yes. Maternity care is essential. If you are well, you should be able to attend your antenatal care as normal. If you have symptoms of possible coronavirus infection, you should contact your community midwife on phone, or to postpone routine visits until after the recommended isolation period is over. If you have symptoms suggestive of coronavirus, contact your maternity services and they will guide you the right place and time to come for your visits. You should not attend a routine clinic. Do not bring children with you to the maternity appointments. There may be a need to reduce the number of antenatal visits. Do not reduce these visits without agreeing first with your maternity team. The maternity units all over the world are increasingly providing consultations on the phone or by video link when this is appropriate. So you do not have to travel unnecessarily to the hospital. However, some in-person visits with the midwife are essential, and it is important for the well-being of you and your baby that you attend these to have routine checkups. The next question is about having your birthing partner with you when you enter into the labor. So if your partner has symptoms of coronavirus, they will not be able to attend. They will not be allowed to go to the maternity suite to safeguard the health of the woman and the maternity staff supporting you. We understand this must be a very worrying and anxious time if you're pregnant and your partner cannot be with you while you're being induced. However, it is essential that the numbers of the visitors to the hospital during this time should be limited. The next question is, what should you do if you think you may have COVID-19 or have been exposed? So, if you're pregnant and you have either high temperature or a new continuous cough, you should stay at home for 7 days. You should contact your maternity unit to inform that you have symptoms suggestive of coronavirus, particularly if you have any routine appointments in the next coming 7 weeks from there. What should you do if you're asked to self-isolate? Pregnant women who have been advised to self-isolate should stay indoors and avoid contact with others for 7 days. If you live with other people, they should stay at home for at least 14 days to avoid spreading the infection outside the home. What happens if you go into labor during your self-isolation period? If you go into labor, you should call your maternity unit for advice and inform them that you have suspected or confirmed coronavirus infection. If you have mild symptoms, you'll be encouraged to remain at home self-isolating in early labor as usual. When you and your maternity team decides that you need to attend the maternity unit, general recommendations about hospital attendance will be applied. The person receiving you at the maternity suite will be prepared with the personal protective equipment, and they will provide you to wear a mask. Wear a mask all the time. Okay. So, will you be able to breastfeed? If you have suspected or coronavirus confirmed case. There is no evidence showing that the virus can be carried in breast milk. The well-recognized benefits of breastfeeding outweigh any potential risks of transmission of coronavirus through breast milk. The main risk of breastfeeding is close contact between you and your baby. So the act of breastfeeding is more important, and the virus is not expected to be found in the breast milk. So the main risk is close contact between you and your baby, as if you cough or sneeze. This could contain droplets which are infected with the virus, leading to the infection of the baby after birth. A discussion about the risks and benefits of breastfeeding should take place between you and your family and your maternity team. The guidance may change as knowledge evolves. When you or anyone else feeds your baby, the following precautions are recommended. Wash your hands before touching the baby. Breast pump or bottles can be used. Try to avoid coughing or sneezing on your baby while feeding at the breast. Always wear a mask. Consider wearing mask at all times whenever you go close to the baby. Follow recommendations for pump cleaning for each use and after each use also. Advice for pregnant healthcare workers after 28 weeks gestation or with an underlying health condition. If you're in your third trimester, more than 28 weeks pregnant, or if you have any underlying health condition such as any heart or a lung disease, then we strongly recommend you. The next is, what precautions should a pregnant woman take? The first is mask. 3 things. It protects others, it protects you, and it limits the hand-to-face contact. There's an unknown incidence of asymptomatic carrier, hence homestay or isolation or work from home or hand wash hygiene they all become very important. If another person in the house develops symptoms, delay your routine antenatal care appointments and isolate for 14 days. If you yourself, the pregnant woman, develops the symptoms, then delay the routine antenatal care symptom appointments and isolate for 7 days. X-ray or CT chest can be done if in doubt, with abdominal shield to protect the exposure for the baby. If visiting the maternity unit with symptoms, call and inform the staff first, so that a health personnel with full PPE can receive you and make her, they can make you wear surgical mask right at the entrance of the maternity unit and shift into the isolation bay. Birthing partner, it is very good if the birthing partner is not from the same household, if anyone has had symptoms in the household. Women above 28 weeks are recommended to be particularly attentive to social distancing and minimizing contact with others at house. Pregnant women are, as I told you earlier, not more susceptible, but they can develop severe symptoms mainly in the third trimester and towards the end of the pregnancy. More chances of preterm delivery for maternal medical conditions are also possible. So the next question is how to deal with COVID-19 patients in the labor, for my gynecologist colleagues especially. The patients must be urged prior to inform the maternity unit on phone if she's a confirmed case or a suspected case. A staff personnel, in that case, you can actually send an email of the symptoms. They should be watchful of those symptoms for all, at least your booked patient, or you can use the public platforms to spread this information. A staff personnel with full PPE should see the patient at the entrance of the maternity unit, and the patient must wear a surgical mask there or before that. Birthing partner not from the same house. Birthing partner to be evaluated for occurrence of symptoms in past 7 days. If yes, leave the maternity unit and isolate. Clear advance guidelines to the birthing partner, including limitation of movement, since the communication is challenging after wearing full PPE. CTG cardiotocography, for all in labor, because a higher rate of fetal compromise has been reported by the Chinese group. For my viewers who do not have medical background, so CTG machine is basically the continuous monitoring of the fetal heart through a machine which makes a real-time fetal ECG basically. So it's a probe which is just put on the tummy of the mother while labor pains are happening to see the baby is coming into stress or not. So at the end of the video, as I promised with you, I will be sharing something else which is useful for these times. So someone who is beginning to read, especially the younger people, I would want to suggest any of these 5 books that you can begin with. The first is one of my favorite authors, Dale Carnegie, How to Win Friends and Influence People. Many of you must be knowing or have read this book multiple times. The second is Think and Grow Rich. One of my mentors, Dr. Rakesh Sinha, had given me this book, and that was one of the first. He used to keep giving me books all the time. This was the first book that he gave me, and it was good at the right time of my career, when my career was kicking start. So the third is basically How to Stop Worrying and Start Living. The fourth is Rich Dad, Poor Dad by Robert Kiyosaki. And the fifth is The Power of Habit. So I'll leave you with this today, and bye-bye. If you want me to choose any particular topics, you have any questions, medicine related, gynecology related, IVF related, anything, please write in the comments below, and I will look after those specific points in my future videos. Thank you. Bye bye. Good luck. Keep safe.